Hi, I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist, and I provide information, education, commentary on injuries, injury treatments, injury prevention for athletes and active people, probably much like yourself, so that you can stay healthy and perform your best. And one of the questions I get a lot is, do I really need to have surgery? Yes, I have an injury, maybe we find it by physical exam, maybe we find it as orthopedic surgeons by x-rays or MRIs, but the people, sometimes the patients ask, do I really need to have surgery? And so in today's Ask Dr. Geier video, I want to address that question, whether or not somebody really needs to have surgery with a specific type of injury, and that is an elbow injury that might require Tommy John surgery. Jessie asks, I'm not a sports player, but I fell on the palm of my hand and tore my UCL, the ulnar collateral ligament. My orthopedic surgeon thinks therapy and no surgery is the best option, but he says I may have limited range of motion. Does that sound normal? Would I benefit more from surgery? I really want full use of my arm. Do they only repair the UCL if you're a baseball player? Well, that's a terrific question, and I think that Jessie's question is an absolutely valid one. We hear about Tommy John surgery in professional baseball pitchers all the time. I mean, I think there was 16 to 20, I think maybe this past season, if not more than that. The numbers are getting higher all the time. But we rarely hear about those injuries in non-athletes. And that's because that's a ligament along the inside of the elbow in here that's involved with stabilizing the elbow with the pitching motion, that valgus stress on the inside of your elbow as you go to pitch. Now the thing is, most of us don't do that motion on a regular basis. If we're just typing in a computer, if we're just writing reports and answering the phones, or even doing physical labor, carpenters, mechanics, things like that, they're not doing repetitive stress like that. Even athletes in non-throwing sports don't do that motion. There were a couple players in recent memory in the NFL that had these injuries but didn't undergo surgery. So if you don't do that motion on a regular basis, you don't typically need surgery. What happens is that ligament, yes, it doesn't heal typically, but the pain goes away. If you work with a physical therapist, you get your elbow motion back. You work on strength with your elbow and your entire arm, and typically you can get back to all activities with no real restrictions. The good thing about that injury too is that if for some reason you didn't do well and you were constantly having aching pain on the inside of your elbow and truly you couldn't do whatever it was in sports or exercise as well as you want, you could come back at a later date and do that surgery, a reconstruction of that ulnar collateral ligament. That's what Tommy John surgery is. But you could do that at any point. That wouldn't be something that would get worse over time. So that would be the good news. So obviously this video is not specific advice. I've never seen Jessie as a patient, but that scenario is very valid. And I think that the answer that his surgeon gave is one that most orthopedic surgeons would give to a non-throwing athlete. Now, what do you think? Have you ever suffered an ulnar collateral ligament injury of the elbow or had Tommy John surgery, and how did it go? I would love to hear your experiences. So below this video, leave your thoughts. I'd love to hear them and I'll try to respond to you as well. If you like more videos like this and want more information on injuries and injury treatments and injury prevention, subscribe to my video channel and you'll get videos like this a couple of times a week. And if you know somebody that happens to have an elbow injury, or maybe their kids play baseball, definitely share this video with them. I'd really appreciate it, and hopefully that information can help them. And if you want more information on ways to stay healthy and perform your best, go to my website, drdavidgeier.com. Sign up for my free ebook, The Year of the Healthy Athlete. It's at the very top of the page, and I share more information on, like I said, ways to stay healthy, perform your best in sports and exercise that I only share by email. So sign up, it's completely free. Thank you so much for joining us. I hope this video was helpful, and I look forward to seeing you right here next time.